Hello guys, yet again. It's been a long time now, but we are back, and so it's good to have you back also. And I hope you all are doing fine. And if you're not, you will be. You will do okay. Yeah, just work on yourself, whichever way you have to, and then you're going to be fine. So this is a new phase, and we are going to be educating each other and on some matters, and matters are talking health. As you can see on the title, I've added that. So it's a segment that we are going to educate each other on matters health. All right, and the first thing I want to talk about in this segment is hemorrhoids. Now hemorrhoids is one of the common conditions that is, has given lots of people, or rather, let me tell you this, hemorrhoids is recognized as one of the most common medical conditions in the general population. And one might ask themselves, oh, so Fritz, why are you talking about the hemorrhoids, right? So this is something close to me. This is something that has happened to me. This is something that I have gone through. So I see it fit for me to share to you, because there is someone out there, or there are people out there who might be having the same problem. They don't know how to go about it. They don't know what it is that they're going through. All right. Yeah. So we are going to talk about the hemorrhoids. And do you know what hemorrhoids are? Or rather, have you ever experienced them and never knew what was going on in your body? Now that is why we are here. That is what you're going to answer. And so sit back and I can't tell you enjoy, but learn whatever you can learn. All right. Yeah. So what are these hemorrhoids? And before I even go further, right, hemorrhoids, you might miss to know when you have them, because, and also in an African setting, it's something that we don't usually talk about. We don't really share much about our health, and more so when we are facing problems that we think it's a shame to talk about them with other people. And I'm going to tell you my experience, but before that, then, now let's go back to what hemorrhoids are. In a layman's term, in a layman's language, we can say that hemorrhoids are the swollen veins in the rectum or in the anus. All right. Yeah. So it's have you ever felt some pain while maybe you're having a long call? Let me just call that. Have you ever felt some pain? And also, have you ever felt something coming out of your anus or rectum, if you like, and it presents, or rather it comes with too much pain or not too much pain, and sometimes you see it, have you ever seen like blood when you are using toilet paper after you're done with your activity in the loo? Have you ever seen that? So sometimes you might have or might not have, although that's why we are here to talk about that. So the hemorrhoids, it's, I say in simple terms, this is swollen vein in the rectum or in the anus. All right. Yeah. But now clinically, I'm going to give you the definition of that. All right. So it's clinically characterized by painless rectal bleeding during defecation, with or without prolapsing anal tissue. All right. So that definition, it's you can say it's a very common anorectal disease defined as the symptomatic enlargement and or distal displacement of anal cushions, which are prominences of anal mucosa formed by loose connective tissue, smooth muscle, arterial and venous vessels. So these are long definitions, and I mean you might not understand them. Just know it's a problem that you suffer when maybe you're going to, most of the time, usually feel it when you're going for a long call or when you're going to the toilet, all right, and not peeing or not urinating, doing the other thing. Yeah, so it's a problem which many people face apparently, but you might not know what you're going through, and that is why it's important for us to talk about these things. I'm going to tell you a story on how I experienced this. So I was in Form 1. That was back in 2014 or 2015. Yeah, 20. No, actually, it was actually in 2013 or 2014. I don't remember very well. Yeah, so I had this issue, right? And the thing is, it came when I had malaria. No, when I had malaria, well, in my family, my mother, my dad, they are both in the health sector. So I was at home, and then the person who was around was my mother, right? And you can imagine how difficult it is to share something so sensitive and something so, I mean, unique and new, something so novel to yourself, and it's in your anus. Now, how do you share that with your mother, right? It's difficult. It's not easy. So I had been experiencing this thing that I didn't know what was going on with myself, right? Yeah. And it was getting difficult for me to do some hard tasks, and they're not like difficult activities as one might think. It's like carrying a jerrycan of water was becoming a little bit, I mean, and I felt there's this thing, yeah, in my rectum, that when I poop and now I'm like wiping, I feel there's something coming out and it doesn't want to go back. So now I kept on asking myself, what is this thing that I usually feel pain when I poop, and then I can't really share with anyone. I didn't know how to talk about it. Yeah. And then eventually I was like, this is too much. The only person that's around, and luckily enough, she's in the health sector, was my mother. And I had to tell her, I'm like, you know what, mom, I think I have a certain problem. And you see, when I go to poop, I told them, this, that. I feel the pain and I see something coming out. You can't go back, so I don't know what it is. Oh, then she told me, I think you have a condition. I think you might be having hemorrhoids. All right. And I was like, what is that? She's like, yeah, that's a condition that is more prevalent in pregnant women and also people who carry heavy weights, let's say in the gym, and people like those. But she was like, I don't know why you're experiencing that, because you're young, you don't really do heavy tasks, or you don't do hard work. And hard work in terms of maybe going to the shamba or stuff like that. But it's a problem that I already had, and now we had to deal with it. So I'm telling you, it's difficult to share that problem with anyone, even if it's your friends. And luckily enough, I was young that time. When you're young, you're not too, I mean, you're not too ashamed to talk about them with your parents, even if it's your mama, right? Yeah. And then now after that, we shared it with my dad, and I was lucky again, because having grown in the healthcare setting, it was so easy for us to find medication and at least hold on for. I mean, I was able to you know to use the medication easily, and I mean, or rather, sorry, to get the medications easily. And then I felt okay. But the other problem is it doesn't go away. It never went away. So can you imagine, ever since 2013 and 2014, I've been having the same problem. So it's recurrent, right? It might go away for 1 year, you forget about it and everything is fine. But then it will come back. Yeah. and it's painful, my friends. Let me tell you that. I mean, personally, I've never experienced anything that painful, because there's this time when I was in uni, so that it went on for a very long time. I was in uni in my second year, yeah. So I had prepared that I want to go to class and all that. I'd already taken my breakfast. I mean, put my books ready, and I want to go. The moment I was at the door, I mean, the hemorrhoid attack came back, and it was so strong. No, I remember I'd gone to the toilet, and then going to the door, I mean, I couldn't even move any further. I just went back and lay to bed. The next thing I knew, I was calling, my siblings and telling them I can't do anything. I can't move from the bed. I need the medications and all that, because I didn't have the medications at that time. So it's not easy. It's difficult. And so I'm going to tell you guys, before I go ahead, let me read you something here. So the true pathophysiology of hemorrhoid development is unknown. It is likely to be multifactorial, including a sliding inner cushions, hyperperfusion of hemorrhoid plexus, vascular abnormality, and tissue inflammations, or internal rectal prolapse, which is rectal redundancy. All right. Yeah, and the risk factors are as follows. One of them is aging. Although I was so young when that attack came to me, so for me, this was not a risk factor, because, I mean, I'm not that old, yeah. I'm not like 50 or something. So abdominal obesity, that is another one, and just obesity itself. The other one is depressive mood and pregnancy. But there are ways that you can cure this, right? The first one is by use of dietary and lifestyle modifications. So the first one in that is you increase the intake of fiber foods. All right. I mean, you should take foods rich in fiber and oral fluids and all that. That might help. And this is in the early stages of the hemorrhoids. All right. Yeah. And the other thing is that under the dietary and lifestyle modifications, it's exercising regularly. But then again, this is where we have a conflict, right? You need to be regularly exercising. However, you should be careful, because sometimes exercising, and specifically when you are lifting heavy weights at the gym, that can also cause, it's a risk factor to cause hemorrhoids. Yeah. So regular exercising is good to help you with the hemorrhoids, but you have to be careful not to lift heavy. All right, because that might make it even worse. Yeah. So the other thing is you should refrain from straining and reading on the toilet. And this, we have to talk about this, because I saw a certain meme going around that the toilet nowadays has become the new telephone booth. And it's true. Like, you can go to the toilet with your phone and you're scrolling on TikTok, on Twitter, on Instagram, or you're reading a book, and then the next thing you know is that you've spent more than 30 minutes on the toilet seat. And that is not good if you have hemorrhoids, or rather just avoid it, because you might be attracting them. Yeah. And the other thing is you should avoid drugs that cause constipation or diarrhea. And now, my friends, this is where there's another big kick in the butt in regards of pain. There is no pain that you can ever feel close to, I mean, and this when you're facing, or rather when you have hemorrhoids. You have constipations, and you have, or rather, sorry, you have constipation and you have hemorrhoids. I mean, my friend, that you'll feel so much pain when you're trying to poop. Yeah. Yeah. So you should avoid drugs that cause constipation or diarrhea. And diarrhea is not that bad, because it's just kind of liquidish, and it's not that like hard solid, which gives you a headache to come out, yeah, but still you should avoid that. And then apart from the lifestyle modification, the other thing is medical treatment. You have the medical treatment, and I want to spend more time here because I want to tell you the way I was helped the first time that I faced that. So the first thing that I encountered was, or rather that I used to treat my hemorrhoids when they first came, was the suppositories. There's something called as the anus or suppositories. So the suppositories you insert in your anus when you have the hemorrhoids, and then it will push them back, and with time you're going to heal. They might disappear and never come back, but unluckily or unfortunately, if you are like me, they are going to be coming back each and every time after some time, like maybe a year, 6 months, and all that. So you'll have several attacks of hemorrhoids, but you'll be treating them as you await for maybe do something major like a surgery or something like that, right? Yeah, so the first thing is you go to the and make sure you go to the doctor, all right? Visit a physician so that you can get clear directions on what you're supposed to do. But for those people who don't know what they're going through, and maybe it's too painful for you, you don't have a medical facility near you, but you can access a chemist, you can go and buy yourself some anus suppositories, provided you know that these are the hemorrhoids attacking you, all right? Yeah, so those helps. And the other thing is, when you find that this is not the only thing that, or rather they're not really treating the hemorrhoids fully, then now you can go to the pills. The pills that I used, now I'm telling you this from my experience, all right? So the pills that I used were the Daflon. There's a tablet known as Daflon. That helps a lot. And the other one, if you have, if you're bleeding from the hemorrhoids, then now you'll go ahead and use the what did you call that tablet again? Tranexamic acid. Now tranexamic acid helped me in the bleeding part, so it helps you stop bleeding, and the Daflon helps you treat the hemorrhoids. And also you use the anso suppositories or anso cream. We also have a cream. So that is the part of medical treatment, yeah. Or wipes. You can use wipes as well, but make sure please you go and visit a physician if you have that problem. And we have another method, which is office-based procedures. So this one, the first one, is rubber band litigation, which is more, I mean, it has been proven to be the most useful one, because it helps to, I mean, yeah, people don't complain of the recurrent attacks of the hemorrhoids when they have gone through the rubber band litigation, according to this guy, La Sirwat 2015, Varut La Sirwat 2015. There's an article he wrote about that. Yeah, so the office-based procedures, one of them I've told you is the rubber band litigation, and the other one is infrared coagulation. And the other one is injection sclerotherapy. We have cyrotherapy. We have radiofrequency ablation. So there are many methods that you can use to treat the hemorrhoids, all right? And now if they're becoming a menace, like you can't check them, I mean, you cannot be able to treat them with these other, all the methods that we've talked about now, then you have to go ahead and consider going for surgery, or rather an operation, right? And it's not scary as you might think, yeah? So this surgery is known as hemorrhoidectomy. So now that is where they go and cut out the hemorrhoids, and then, yeah, you pray to God that they never come back, and then you'll be good, all right? Yeah, and there are two categories of the hemorrhoids. We have the internal and the external ones. I'm not going to go deeper into that in this particular video because it's already long enough. I don't know if, but if you've reached this moment, I'm proud of you, and you should congratulate yourself because you've learned something, haven't you? Yeah, and so we are going to have a part 2 of this. Not just me though. I'll be talking about the hemorrhoids with another person, a health expert and a health student, or rather a medical student. Yeah, so we'll be educating each other. I want you to be informed, and please, you should share this video widely because it's going to help someone out there. And I'm going to tell you why. Because there's this time when I was in a certain hospital. I was working there, and the an old there was this old papa, or rather an old man came. He was holding his anus, you know. I mean, his hand was in his anus. You could see he had trouble sitting down, and he didn't know how to explain the problem because it was the first time that he had experienced it. And this is an old man. And luckily enough, I was at the counter, so he found me there. He told me, I think I have a problem. I don't know what it is, but I mean, I feel this type of way. And luckily enough, you see, I had the same issue. Although for me, I was lucky enough to be treating it every time that I experienced it. So I didn't give it a chance to really bring harm to me in terms of feeling too much pain, all right? Yeah, and then when he explained it to me, I told him this is a certain problem and da 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 da. I referred him to one of our doctors who was there. And yeah, he was helped and he was given the medication and all that. So please share widely because there are people who do not know. They might be going through this problem or they might be having hemorrhoids, and it will be of help or of significance to them to get the information. All right. Yeah, I believe you're going to do that. And so the other thing I was gonna talk to you about previously, you've seen me doing the other videos of I mean, it's just like, it's kind of gossip, you know, and gossip doesn't really help you with much. I decided that I'm going to be doing something also which has an educational value, or it's informative to the society, to you guys. Yeah, it's not just about gossip, you know, right? Yeah, we have to educate each other on serious matters that are facing the society, and health is one of them, if not the top, right? Yeah, it's among the top, or if not the top priority of everyone's life. I mean, you want to have good health, right? Yeah, and if we can teach each other on few things here and there, that won't hurt. It will actually be impactful. So I believe that you guys are going to share this video widely so that your peers and your friends and your relatives and some other people that you just know going to also get the information. Yeah, thank you for watching this far. I'm Fritz Ignatius, and I hope to see you on the next one.